All right, guys, welcome to the Omega Sports Show. I am Dell with Omega Sports. We've got a Mega Wellness Wednesday show for you today. We are welcoming back our good friend and the doctor that started it all with us way back when, before COVID, before everything, Mr. Dr. Clay Sankey from TruMotion Therapy. Good afternoon, sir.
Hey, Dell. Good to be with you.
Good to be with you. I just said to you prior to going live, it feels like it's been a long time since we've talked, right?
A lot has happened. Yeah.
A lot has happened. The world has happened between the last time we did one of these, right?
Yeah.
Yeah. Well, I want to just briefly talk about how are things going with you, your family, the office? How are things going?
Yeah. It's been 2020 was a tough year for everybody. Fortunately, I think we weathered the storm pretty well. Feel really good with the position we're in right now. So I have a young family, 2 young kids, 2 under 3 years old, and they don't. For a while, they didn't know what the outside of the house looked like. So it was we were getting a little stir crazy and everything, but was fortunate enough to be able to keep the business open. Really didn't miss a single day of seeing patients due to COVID. So feel really good about that. And we feel like we kept everyone safe and healthy during this time, everyone who was coming into our business and everything. So feel really good about it. Yeah. And there's definitely a light at the end of the tunnel, it seems like. So happy about that as well.
Yeah, I want to celebrate the work that you did, because I remember we were doing these shows and we were checking in on you. You're obviously an entrepreneur. You're a local business owner in the Charlotte area. I should say you're the Charlotte chiropractor. We like to call you. And you and your team were working really, really hard to continue to meet the needs and the demands of your patients. You know, I know at one point you were kind of staggering your schedule, making more space for folks. Obviously, always keeping it clean, keeping it disinfected. You know, how are things changing? That light at the end of the tunnel, how are things changing? Are you able to get your patient roster back up to more of a normal level?
Yeah. At the beginning, we were worried. We thought things would really die down a lot. People wouldn't want to come in, but we really didn't see a decrease in demand for care. And I attribute that to a couple things, gyms being closed and people running more. So we're seeing more running injuries, and I think we're going to talk about that later. And then people working in a different environment. So they're sitting at their couch, sitting at their kitchen table, putting different demands on their body. So we saw a lot of increased neck pain, back pain, and stuff like that. So yeah, we still saw an increase demand and people wanting to come in and get care, but we had to balance that out with, okay, how can we keep it safe? How can we minimize the interaction between patients? And we did that, throughout the summer and early fall. And as things started to get cool down a little bit, and we honed our processes in a little bit better, we could start seeing more and more people. Now we're running full steam, still keeping things safe, continuing our same cleaning protocols and mask wearing and everything like that. But we've certainly got used to it at this point.
Yeah, you guys have become pros. I want to give a shout out to you. Rashawn over there in, I believe, our Arboretum store says, "Hey, what up, Doc?"
What up, Rashawn?
It's been a while. With you. Yes, yeah. Rashawn's going to agree with you. Obviously, at Omega Sports, we saw a huge increase in running. Everyone decided that, what, gyms are closed, but I've got to stay active, if not now more than ever. I mean, with a global pandemic hanging over your head, maybe fitness and wellness became more of a focal point. So we saw obviously an increase. And like you said, I heard you say that you saw a lot more of an increase as well. What are some of the common injuries that you saw in your practice?
Yeah, so running specifically is going to be primarily overuse injuries as a result of what we call training error. So short of slipping off a curb and spraining an ankle, pretty much everything is overuse. So the big players that we saw were knee pain, and you can kind of classify your patellar tendonitis, runner's knee, IT band syndrome, that kind of thing. Saw a good bit of that. Then your foot and ankle type stuff, plantar fasciitis, Achilles tendonitis. Just a lot of kind of tendonitis type injuries. And then kind of into the desk worker, quite a bit of neck pain. We saw more neck pain than we ever have in the past year.
I will tell you, if people want to go back into our archives and watch, or just go to your Instagram and watch your, working virtually at home segments that you did, they were fantastic. And they helped a lot of folks, because you're right. A lot of people went from being, mobile in the office, running around, talking, going meeting to meeting to meeting to meeting, to now having to sit in front of a computer with a camera and go meeting to meeting. And that put a lot of extra pressure, especially for folks that don't have that fantastic fancy chair that they had in the office. They're using their kitchen counter stool or their kitchen table. Getting your proportions right, you really helped a lot of people. I remember that being a very popular segment that you had on your Instagram and of course your YouTube channel.
Well, I appreciate that. And it really comes down to kind of lack of movement. So or less movement than you're typically getting on a normal, work day. You're getting out of bed, you're, going for a walk, whatever. And then on your way to commute to work. And then there's probably more walking around your office or anything like that, that you're used to. And then your commute back home. Whereas if you're working from home, I mean, your steps are limited, really.
Yeah. Yeah. Well, that's why we have you here today, because obviously you're dropping a lot of knowledge. We were absolutely able to follow you through Instagram and your YouTube channel, which I'm going to do a shout out to you later on. But yeah, as you remember, I have to do some Omega news. So I'm going to have you hold for me while I go ahead and do some Omega news. And then we'll jump into more of those expert sharing that you have with some of the questions that came through.
Perfect. I'll be here.
All right, great. All right, guys. So for Omega News, the real highlights right now is, number one, we've got a new podcast that I'm going to play for you in a second from another Charlotte doctor, Dr. Scott Jablanca, who is our host of the Move More podcast from Omega Sports. He, of course, is the Carolina Movement Doc. I'm going to play you a snippet of his newest podcast in a second, but I do want to give you heads up on some promotions. We've got swimming. If you're a swimmer out there, talk about getting out there and saving some good money on some new swimming equipment. We've got what's called our Splash Pass that's happening right now. You can take $20 off of a purchase of $75 or more on swimming. So if you're picking up a suit, a couple of pair of goggles, some great accessories for the pool for that competitive swim season, or you have a child that is a competitive swimmer, please make sure you go to your neighborhood sports store and check us out. We've got that Splash Pass. It is going on until next Wednesday. It's 20 off of 75. So as swim meets are starting up, teams are forming, you're getting out there, you're training, make sure you come to your neighborhood sports store so that we can get you geared up for a successful winning swimming season. All right. And then, of course, everyone that's moving. We talked about it with Dr. Sankey. Everyone's moving now. So why not track your results with the brand new Garmin smartwatch? We've got Garmin on sale, $50 off. Select styles, but a good number of them. If you go to omegasports.com, you can save $50 off on Garmin Forerunners, Venue SQs. If you are a Garmin fan, this is your time. This is your time to go online and start saving on your favorite smartwatches. And remember, only at Omega, we call it our OAO, only at Omega will you also earn money back. So if you're buying a Garmin, you're saving $50, but we're also going to reward you with faster Mega Rewards of $5 on every 50 that you're spending at Omega Sports. So save on Garmin $50 and you're earning $5 on every 50 you spend. So go for that better model. Go for the bigger model and know that you're going to make some money back for your next purchase. Only at Omega. That is our OAO. All right. So right now I want to go ahead and play the latest podcast drop that we just had actually a couple days ago from Dr. Scott Jablanca, who is Carolina Movement Doc. He is our host of our Omega Sports Move More podcast. And this particular episode, he talked to veteran athlete. He called him a veteran. I didn't call him a veteran. Veteran athlete Thomas Clark about what it's like for veteran athletes to continue to keep working out, continuing to keep pushing themselves to hit the next level.
You have to listen to yourself. Your body will tell you when it's time. You can't let your ego get in the way. And that's the biggest thing that we all as veteran athletes deal with, is the fact that, but I used to. It's like, but you still can, but you can't do it like you did.
Oh, absolutely. We all used to do something. I used to be a incredible, I don't say incredible, elite soccer player. Absolutely. Anywhere that I needed to put the ball on the field, I could do that. If I needed to sprint the entire length of the field, I could do that without even losing a breath, without losing a step, and with an amazing touch. I can't do that anymore. So tough. Some of that is just, swallowing that pill.
Right. Right. Yeah. You listen to yourself and you'll be perfectly fine.
All right. Well, I invite you guys to check out our podcast. Of course, we've got several podcasts that we do every single week. Let's make sure that you guys know where to go. Go to podcast.omegasports.com. Just go ahead and click down on the Move More podcast to hear the latest from Dr. Scott Jablonka. Does a great job every single week. He's got more guests coming. Maybe soon we'll even have Dr. Clay Sankey join an interview with Dr. Jablonka as well. I don't know. I think it's in the works. But definitely check out the latest podcast. This is a good one that talks about the fact that no matter what age, we need to continue to keep moving. And of course, that is what the Move More podcast point of view really is. And to hear from Thomas Clark, a gentleman who went from the couch to, CrossFit in a big way, definitely you want to hear his story. Just go to podcast.omegasports.com. All right. So speaking of Dr. Sankey, I want to go ahead now and pull up my screen because I have the luxury of knowing Clay, knowing all the great work that he's been doing in Instagram and in YouTube, but I want to give you guys a sneak preview of what that looks like as well. So let's go ahead and pull up the screen here, because I will tell you, Omega Sports first became fans of Dr. Sankey through Instagram before we ever met. And once I saw all this great content that he was putting together, both long form videos, short form videos, quick healthy wellness tips, great stretching tips. I mean, it goes on and on. We became huge fans, and I was literally just begging to work with him. And when we launched the Mega Wellness effort at the beginning, before the world decided to become healthy again, we were kicking off 2020 as a Mega Wellness year for us at Omega Sports. And Dr. Sankey was really one of our core folks that we really zeroed in on, because he was doing all the right things. He was sharing great content. It was being really received well from all of the folks in his following, both in Charlotte and beyond. And it's just easy to follow, great snackable or digestible pieces of content that really do help you. If you've tried, like right now, we got on the screen one of his stretches. If you're trying these stretches, it's quick, it's easy, you can try it, it will make a difference. We saw it time and time again. Every time we had him on our show, every time he's answered any of our customers' questions. Lots of great content here. So I encourage you, of course, I'm sure after the segment today, you're going to fall even more in love and have high interest in all things TruMotion therapy. But I want to definitely make sure that we give a shout out to all the great work that he's doing. And not just on Instagram. I want to give a shout out to his YouTube page as well, because I'm a big YouTuber. I love to be able to watch videos. I love to be able to see things and share things instantly with folks. So definitely check out his YouTube page as well. As you can see, plenty of videos available, quick tutorials, quick tips, great stretches, lots of fun wellness information for you that, again, is easy to digest, quick and easy. You're not going to be watching an hour-long video talking about neck pain. It's going to be exactly what you need to help you get moving again, or to improve, or to maybe even just ask the right questions to your doctor or your chiropractor, whatever it is. These videos are very informative, and so I want to applaud him and his team for putting together such great content. All right, so let's go ahead and bring Dr. Sankey back on, and let's get to know him a little bit more after I bragged about him for, a minute or two?
You're making me blush.
Well, normally I play a video, right? Normally I just have an easy way. I'm like, let's play the video, roll the video. And then a video tells the story. But today I decided I really wanted to I wanted to hype you up on Instagram. But then I have to remember that you're putting a lot of this great content on YouTube as well.
Thanks. My YouTube is somewhat of a hodgepodge, but I definitely put a lot of effort into the Instagram. YouTube is, I kind of throw the videos. I try to make it as cohesive and everything as possible, but definitely a little less structure on there.
So the confidence in the brand may be in Instagram, but I'm telling you, I've checked out your YouTube, and I love sharing and sending people your videos off of YouTube as well.
I appreciate that.
Yeah. Well, let's get to know you, Dr. Sankey. So I know we know a lot about you, but I want to make sure that we're for the 2021 version, let's get to know you more. So I know you grew up in Charlotte and you were a runner in school. Can you tell us a little bit more about your background?
Yeah, so I was actually born outside of Cleveland, moved to Charlotte right before high school, and started running right around that time. ran track and cross country throughout high school because I was not good at throwing a ball or doing much hand-eye coordination. But running was my passion anyway. So ran throughout high school at Providence Day School, amazing running program there. They still are dominant. They just won the men's and women's, or boys and girls, state championship. And then I went on to run at Elon University as well. And moved away for grad school and then moved right back to Charlotte because I love it so much.
Yeah, I want to point out, and I wish I could just have our producer just pull it up on the screen, but don't worry, I'm not going to. But I definitely want people to check out your Prefontaine hair that you rocked while you were running.
Oh, yeah.
The long locks.
Yep. Yeah, I had that before I met my my current wife. My roommates told me I had to cut it off before I asked her out. So that was enough of the hair, and now I'm married. So maybe that was it. I don't know.
That's funny. I always say I used to have hair down here, and then I cut it off too. And I met my wife, and I keep saying I'm gonna grow it back, and it never gets more than just a really bad.
Yeah.
All right. So you ran in school, and of course you graduated, and then you became a business owner. Tell us about starting TruMotion Therapy.
Yeah, so in chiropractic school, I knew I wanted to work for myself. So that was kind of in the works while I was finishing up school. Moved to Charlotte and opened up TruMotion Therapy. My chiropractic clinic wanted to do things a little bit different than some of the other chiropractic clinics that I've had experience with in the past. Wanted to provide patients with longer treatment times, more one-on-one time, truly individualized care beyond just the kind of snap, crackle, pop that can happen at a lot of chiropractic offices. Not that there's anything wrong with that. I just wanted to do something different. And I think we offer a lot of different techniques and services really to meet the individual that's in front of us. And number one, I'm a clinician. I love to work with patients, but being a business owner, you wear many hats, including accountant and janitor and all that stuff.
Videographer, content writer, marketer.
Yep, absolutely.
Well, you're doing a good job. You're doing a great job. So I want to make sure people know. So when people think of chiropractor, they think of just, you said, snap, crackle, pop. Mm-hmm. And of course, no judgment on that, but you also offer a lot more. So tell everyone, what array of services can people find at TruMotion Therapy?
Yeah. So as a chiropractor, I do chiropractic adjustments, which is what people traditionally think about when they think about chiropractic. Beyond that, we do a lot of soft tissue work as well. Soft tissue work can involve manual work, how to use in your hands, take a massage. It can involve using instrument-assisted tools as well. If you've ever heard of scraping, that's a common one that people will get when they go to a chiropractor or a PT, as well as cupping. We do needling as well in the forms of dry needling and acupuncture. And those are actually some of our most requested therapies, believe it or not, mainly because they are just so effective at reducing pain and muscle tension. And then we do a lot of rehab and exercise work as well. So just like you guys, you preach movement and exercise, we are the same way. In the end, we want to get people moving and feeling good and confident about their movement. So everything we does revolves around trying to get people moving again. So I'd bring you out into our gym right now, but we got someone out there on our treadmill running. So I want to respect their privacy, but that brings me to another thing. We have a Alter G anti-gravity treadmill, which is fantastic. Fantastic for reducing running injuries, or rehabbing running injuries rather, because it allows you to run at a lower body weight, so you have less impact on the ground. So another great way that we help runners.
Yeah, and I certainly appreciate not intruding on someone else's care, but I was actually about to say, I wish we could just pull up a video, because when I went on my first tour with you, what I was surprised to see, which I do think I would say makes you different than other chiropractic folks out there, is that you do have this gym setup. I mean, if you go to your Instagram page and people see you doing the workouts, that's in your offices right there, and you're doing that with patients, and you're showing them and teaching them how to do the movements themselves. You've got your exercise bands, you've got your weights, you've got your bars, you got everything kind of set up there, which I thought was, a big showstopper when I was there.
Yeah. And basically, I mean, I kind of created that gym around something that I would want to use. So I work out here at 5 o'clock every morning. So it's everything that I use and, use with my patients to help get them moving again, whether they're a weightlifter who wants to, squat better, a runner who wants to be able to, race without pain, or, a swimmer, name the athlete.
Yeah. And I think it's important to mention that you're not only just helping people who are dealing with injury. Of course, that's a huge segment of folks that reach out to you, but you're also on the preventative side too. You're helping people, condition and stay healthy so that they can move more.
Absolutely. Yeah. I mean, as an athlete, your greatest piece of equipment is your own body, and you need to be able to maintain it and, take care of it just like you would if you're a lacrosse player and you keep your, your stick restrung, or a runner and you replace your shoes when they need to be replaced from Omega Sports. So yeah, so when you're when you're an athlete, you need to make sure that you can keep up with those little things. It's better to prevent than try to put out the fire once it's already started.
Yep, absolutely. Now, of course, we talked about you wearing many hats as a business owner. So you went to school, you've opened your practice, and now you're wearing many hats. So let's talk about this content creation that you've been able to master on Instagram. What made you think, let's just put this content out there for everyone? Because of course, you're in the business as a business to charge people for your expertise and your advice, but you're sharing it willingly to a much larger population of people, and you're sharing it, multiple times a week.
Yeah. Well, master is a very nice term. Incorrect, but still very nice. So yeah, really my purpose and what I do is to get people moving and feeling better. And if that involves providing free information and content out there, anything that can help somebody get there, then I'm happy to do that. I don't see it as taking away from my business at all. And it's not completely selfless, right? People see me doing things and talking about neck pain or talking about ankle pain, and maybe associate me with someone who can help fix that. So, truly the core of putting that stuff out there is wanting to help people. And where I come up with the ideas is, okay, what did I just work with the patient on this morning, and can I make a video about that? Or what am I struggling with myself? Is it something that I need work with, whether it be hip mobility or shoulder mobility, and can I make a video on that? So all real life, I try to make it pretty applicable, that you can just kind of scroll through there, see something that might apply to you, and click on it. And I try to keep the scientific jargon to a minimum, and keep it pretty digestible for the layperson.
Yeah, well, you're a huge fan. We're huge fans of yours. And then, of course, the folks at Omega Sports, all of our active play experts, our market leaders, our corporate staff, everyone is always so impressed with any video. And I'm like, look, check out this cool video that Dr. Sankey just did. Huge fans. And obviously, I know the answer to this, but, how are people in your community responding to this content?
I think they respond pretty favorably. We get a new patient every week or so coming in who's heard of us from Instagram. Yeah, I think it's been pretty beneficial. What my favorite thing is, it's connected me with people in the community, people like you guys, the awesome folks at Omega Sports, and other chiropractors, other physical therapists, personal trainers, dietitians. I've made amazing relationships. Just putting the social and social media, just by putting that stuff out there. People that I would not have met otherwise. Scott Jablonka, the Carolina Movement doc, I met him through social media. So making these connections has just been tremendous, and those people have become great referral sources, where I can send patients if they need a great dietitian or an amazing running store to pick up swim gear that's currently on sale, or an awesome Garmin watch.
There you go.
But it's help us make awesome connections within the community and everything like that. So there is a bright side to social media, I believe.
There is. And we certainly have seen it. And of course, when you go with, just openly sharing good content that would only improve people's lives, I think that's always a great place to start. And I know when I was talking about our Move More podcast, I jokingly, but not so jokingly, said we need to get you on there. So we need to make sure that you're part of the Move More podcast. We got to get Scott to interview you so you guys can, Charlotte it up a little on this podcast.
Let's do it.
Yeah. Well, he's a big fan of yours. I remember when we first started with him, he said he was a huge fan of yours and kind of loved what you were able to build on social media. And then just the brand itself just was very succinct, and, your website, everything is great. So huge kudos from other colleagues there.
Yeah, Scott's the best.
Well, good. So we've got a lot of questions, a good handful of questions, but I want to start with a selfish one from our producer over here. Mary's our producer. If folks that have been watching the show, she's going on a road trip. She's taking the adventure. She doesn't want to fly because she's a little worried about, catching something, I guess. But she wants to take that wonderful road trip across the country to go to the Grand Canyon. She's going to go see her mom in Arizona. And her question to start things today is to see if you can help her with any exercises that people like herself may experience when they travel long distances, or just start traveling again. Because, things are opening up and people are starting to go out more, and maybe they haven't seen their in-laws or seen their family members in a while, and they take that long trip. So I think it's a good question to start off on.
Yeah, it's a great question. And a little jealous of Mary and a little hesitant to actually help her out here, but I'll do it anyway.
I totally agree with you.
Yeah. So I mentioned this a few times on this episode, but one of the more common things that we've been working with is neck pain, and that is something we see a lot when people are traveling. So we're going to go over 3 stretches that you can do to help prevent neck pain, not treat it. This is not medical advice. If you have neck pain, see a doctor. But just prevent neck pain, keep yourself moving well while you're traveling, sitting behind the wheel of a car, sitting in a plane, sleeping on a different pillow, that sort of thing. So I have my intern, Michael, with me today. Whoop, there we go. And he is going to help me demonstrate these 3 little stretches here. So the first one that we're going to do is called the corner stretch, and it is specifically designed to address tightness within the chest. So right in the pectoralis muscle here. If you're going to be sitting behind the wheel of a car, arms in front of you, your pecs are going to get tight. Sleeping on a different bed can cause some tension in that area as well. If you can loosen up the pecs, you can take stress off the shoulders, take stress off the neck. So I'm going to have Michael demonstrate this stretch right here. So there we go. Okay. So what he's going to do is he's going to put his forearms vertically against the wall. Elbows are going to be at about 90 degrees. He's going to be in a staggered stance. So one foot in front of the other. And then he's going to drop his chest in towards the wall, just like that. And he should be getting a really great stretch in the front of the shoulders right here. We shouldn't feel any sharp pain on the top of the shoulders, nothing in the back, just a nice stretch in the front of the shoulders. And you want to hold that for about 30 seconds to a minute. Okay, great. Thanks, Michael. So that is the first one we're going to do. All right. The next one, I'm going to flip things around here. And I'm going to have Michael lay on the table with a foam roller that we picked up from Omega Sports. And yeah, he's going to lay flat on the roller, upper back on the roller, feet flat on the floor. And what he's going to do is he's going to press the back of his head into his hands and arch his back over the roller. So what he's trying to do is he's trying to mobilize his upper back, his thoracic spine. If we can mobilize that area of the spine, we're going to be taking a lot of stress off of the neck. Because how do we spend most of our time when we're traveling? We're slouched like this on our phones because we don't want to look at anybody. We're sitting behind the wheel of a car, slouched over, that kind of thing. So he's just going to roll through that area of the spine, hitting, which is going to be hard to do on this table, but hitting areas higher up on the spine and a little bit lower, but we don't want to travel into low back territory. So that is rolling out the upper back. Perfect. All right. We're going to flip things back around, and Michael's going to have a seat on this chair right here. And what he's going to do is he's going to do a stretch for his levator scapula. The levator scapula attaches to the top of the base of the skull right here and goes right to the shoulder blade. So if he's going to stretch his left levator scapula, he's going to sit on his left palm, and he's going to take his right hand, put it right at the base of the left side of his skull, and just pull down into the side, stretching out this muscle. You just want a gentle stretch right there. You're not trying to get any pops out of your neck or anything like that. Just a gentle stretch through that muscle, and you're going to hold that one for only about 10 to 20 seconds and then repeat as needed. Perfect. Thank you, sir. So those are our 3 stretches that you can do while you're traveling to help prevent any kind of aches or pains within the neck. Again, if you're experiencing neck pain, see a doctor. These are not meant to treat neck pain. It could make it worse if they're not done properly.
Yeah. So what I love about that, thank you to your wonderful assistant with the great head of hair there. Did a great job. And what I wanted to say is that it was pretty simple, right? So if you're sitting in a position for a long period of time, find that corner, do that little extra stretch, get those muscles stretched out. If you are able to invest in a foam roller, definitely, Omega Sports or anywhere else you can go to get a foam roller, definitely kind of roll out and put that little extra pressure on the back. And then just that neck stretch that you talked about, I think we all can benefit from that neck stretch.
Absolutely. Yep.
Well, Mary's over here saying that those are fantastic. She will definitely make sure she does every single one of those while she is stopping at every gas station that she needs to on her long journey across the country to the Grand Canyon.
Good. I would like proof of that, please, Mary.
Exactly. And then I would like you to add to that where you need to have her go through her hiking trails in the Grand Canyon and do that on a cactus.
That was Dell, not me.
All right. Well, we've got some other great questions besides Mary. So let's go ahead and jump into some of our customer questions. A lot of these questions are revolving around, obviously, chiropractic needs and mobility needs. I'm going to kick off with your hometown there, Charlotte. John from Charlotte says that I have a 14-year-old rising soccer star. Should I proactively seek out a chiropractor for her, or is she too young?
She's certainly not too young. This is a great time to start with chiropractic care or some sort of movement-based therapy in general. When athletes are young, it's a great time to start habits of stretching and preventative work. So 14 is definitely not too young to start seeing a chiropractor. Honestly, there are chiropractors who see babies. I'm not in that kind of world. I don't do pediatric chiropractic, but we tend to treat 12 and up. So 14 is a great time to start seeing a chiropractor and getting that kind of work done.
And so this is one of those key moments of clarification where you don't have to be injured to need support and guidance and expertise from a chiropractor. It really can be you're just active and you're pushing your body in different various ways to kind of take your athleticism to the next level. You can be more proactive and seek out help.
Yeah, and a chiropractor or a physical therapist who's more movement-based is going to have an eye to recognize movement patterns that may lead to or may predispose you to injury in the future. So they can pick apart that kind of thing and hopefully get to it before anything happens that would need actual rehab.
Yep, I love that. All right, so we're going to stick in your hometown here with Charlotte. So Melissa from Charlotte, do you recommend pregnant women getting adjustments? And is there a special certification for, I guess, a chiropractor if someone's pregnant and they need to get an adjustment?
Yeah, so I definitely recommend pregnant women get treated by a chiropractor. We see a number of pregnant women. We have midwives and some OBs that refer some of their clients into us. That's a really, really important time to be treated because your body is going through so many not only hormonal changes and but biomechanic changes as well. So you're getting the increase in belly size, which is putting stress on the spine. Your abdominal muscles are stretching, so you're losing that ability to stabilize the spine. So there's a lot going on. And then especially postpartum, that is a really important time to start seeking care, because your body just went through a tremendous stress, right? Whether you had a regular vaginal birth or a cesarean section, right? If you have a C-section, that is abdominal surgery. You're getting yourself cut open. Any other circumstance, you're going to PT for no less than 6 weeks. But if someone has a cesarean section, they're just asked to like continue on as normal. It's kind of crazy. But yeah, so when you're pregnant and postpartum, that is a really important time to continue to take care of your body, because you're doing a lot in that time period. And as far as certification goes, there are some certifications out there. There's one called the Webster Technique. There's another one called DNS, Dynamic Neuromuscular Stabilization, which is tailored towards kind of movement based and can really help pregnant women as well. I would say the biggest thing is to either ask your OB if they have a good recommendation, or if you have a midwife, ask your midwife if they have a good recommendation. And then you can always call up the offices as well if you have a chiropractor near you. Just see if they feel comfortable treating someone who's pregnant, or if they have experience treating someone as well.
Yeah, what a great answer. That's a great question, and I'm glad you were able to weigh in on that. I love the fact that, first of all, I think every pregnant woman is going to want to come see you at TruMotion Therapy now, because you've recognized that they're putting their bodies through a tremendous amount of changes. Mm-hmm. And so to have a thoughtful, expert to kind of help guide them through it, I think is fantastic. I think, the C-section alone, you're right. If anyone else was having major surgery like that, they would automatically be required to go through physical therapy. Yeah. And then I would only assume that maybe a nice getaway from the family to go and have some alone time while you're getting treated might also be a win for maybe a new mom as well.
I tell my new moms this all the time. I'm like, if you want to tell your husband this was like a 4-hour appointment, just go get some coffee or something like that, I won't tell. That's fine.
Yeah. Love that. All right. So Tanya in Greensboro has a question, and this one, I think we've actually addressed this question before, but I'd love for you to weigh in again on it. Can you share how you work with patients with TMJ?
Yeah, so TMJ stands for temporomandibular joint. That is your joint right here. It's your jaw joint. So everyone has a TMJ on either side. When you have dysfunction or pain in your TMJ, that's called TMJ syndrome or TMJ dysfunction. If you have TMJ syndrome, there's a couple things. Obviously, working with your dentist is important to make sure things like occlusion are correct. If you had recent dental work, that's going to come into play. Beyond that, there is a huge musculoskeletal component to TMJ syndrome. You can have tension, tightness within the muscles around the jaw. You can have poor biomechanics within the jaw as well, which puts stress on the little disc that's in that TMJ. Just like you have discs in your spine, you have a disc in the TMJ. And then we'll take it right back to the neck. The neck plays a huge role in TMJ syndrome as well. So when we're dealing with someone who has musculoskeletal TMJ syndrome, something that's not due to poor occlusion or some recent dental work, we will always address the neck, mobility issues in the neck, and we will always address the actual jaw as well. We might do that with some soft tissue work or needling on the outside of the jaw, or some soft tissue work intraorally, just working through the muscles that you can only access within the mouth. So that's a big way that we'll start to address TMJ. Additionally, some of the muscle knots that can develop within the trapezius muscle right here, if you just go poking around your trap muscle, you may find some tender spots. Those muscle knots will commonly refer pain up in a ram's horn pattern. So refer pain up the back of the neck, through the head, right behind the eye, and then sometimes into the jaw as well. So sometimes people won't even have any issues with their jaw, and it's just a muscle knot right here. And if we can take care of that, it'll alleviate their jaw pain. But most of the time, we're doing some work on the jaw as well.
Wonderful. That's a lot of good information there. Yeah, I definitely think that if folks can, I didn't even think about that, but it may not just be your jaw has to hurt. It may be something else that's actually kind of drawing in the pain.
Right.
Yeah. Another great reason why you can get proactive about your health and your wellness and go see someone that actually can tell you, hey, I think you may have an issue over here, which is causing an issue over there.
Yeah.
Awesome. All right. So Sarah from Charlotte says, what are some fundamentals everyone needs to consider before starting a new exercise routine like running? So we talked about this early on, where everyone in the beginning of COVID just decided, well, you know what, I can't go to the gym, I'm just going to start running again. And you saw an increase in, I heard you say, injuries and, people just kind of not preparing correctly. So what are some of those fundamentals?
Yeah. So anytime you start something new, you need to ease your body into it, because that new thing is going to be a stress on the body. So running is a stress on the body. It's good to stress the body, but we need to pair it with appropriate recovery. So oftentimes when someone gets into running, they're really excited to get into it, signing up for a 5K, 10K, or marathon, something like that. And they just want to get after it. But it's important when you stress your body with running, when you stress your body with any kind of new activity, Orange Theory, whatever exercise you're doing, you need to pair it with the appropriate recovery. So recovery is going to be really important. Specifically for running, if you can start with a good base level of strength, that's going to be hugely important. So runners don't strength train nearly enough. If you can start off by doing some strength training to supplement some of that mileage, that's going to be really important too.
Yeah, that's a great point. Actually, I think on a previous podcast, the Move More podcast talked about why runners should do more strength training. So that's a check mark for us on the podcast.
Nice. Yeah.
Yeah. Well, that's good. And then, of course, there's obviously the basics of, nutrition and hydration and all those. Those are fundamental. But yeah, definitely, a good pair of shoes, getting fitted properly would be very important. But I love the fact that recovery, what most people, to your point, they get so gung-ho for it that they just want to keep pushing themselves. And because I know a lot of people train themselves, or they fall into the idea of running is more mental. Well, it's definitely more mental to keep going, but if your body's in pain, you need to make sure that you're recovering as well.
Yeah, absolutely.
Yep. All right. Well, it looks like we have one more question. Tim from Raleigh said he was in a car accident and went through physical therapy to recover. What do I need to consider before seeking out chiropractic help? So it looks like maybe he was done with his physical therapy and now he wants chiropractic help.
Yeah, so that's a good question, Tim. I would kind of ask yourself what you're hoping to get out of it. Are you hoping to get out of it kind of general wellness? Are you looking for a more kind of exercise-based prescription? When you answer that question, then you can kind of narrow down what type of chiropractor you want to see. I would additionally, if you have a chiropractor near you, give them a call and speak with them about what those goals are. But looking for a chiropractor that kind of will take that time and talk to you about it is going to be really important, because regardless of the techniques that they offer, they'll at least give you the time of day and show you the care that you need. But after a car accident, something traumatic like that, and you've been through good physical therapy, it's important to keep that ball rolling.
Yeah. All right. Well, I want to give you a chance to talk about TruMotion therapy some more. So if there's some new things coming up with TruMotion therapy, some things that you're excited about, even if it's the fact that maybe you'll be able to have more patients on your schedule, feel free to share that with us.
Sure. Yeah. Thanks, Del. We are making some changes so we can get more people in on the schedule. And that will be starting kind of this week and next. So if you head onto our website, go to TruMotionTherapy.com and click book now, you can see our schedule and get on there if you'd like. Always check in on social media. If you want to reach out to me directly, you can do that. Slide into my DMs or email me, clay@TruMotionTherapy.com. We have a massage therapist who is here full-time now, and she's awesome. You can also book with her online. And then, like I said, if you're a runner and you're experiencing any kind of running injuries, or you just need an excuse for a really, really easy recovery run, our Alter G anti-gravity treadmill is available. And it's just an amazing tool. I get on it pretty frequently just for easy recovery runs. If I'm feeling a little aches and pains, I'll get on it. That's also available to book online, and we can have a chat about that as well. So yeah, that's pretty much it. But yeah, Del, I really appreciate you giving me this time and all your viewers, awesome questions and everything like that. It's always a pleasure to talk to you guys and speak with someone who has a shared love for movement and just keeping people well.
Absolutely. And just a reminder, where are you located in Charlotte? So folks that can zero in, how close can I get to Dr. Sankey?
We are right down the road from Omega Sports in the Arboretum. So we are right off Pineville Matthews Road, kind of near Carmel Road.
All right. Well, maybe we need to do a contest. We need to get some of our runners to do your anti-gravity machine. We'll have to think of a fun.
Cool. Yeah, we'll do it.
And we'll bring the video crew and we'll do something safely in your office without intruding on all your other patients. But like, do something fun, because you do get a lot of folks asking about that, and I know I keep referring people to you when it comes to that.
Yeah, I appreciate that.
All right. Well, I want to give you back. I know you have a busy schedule. I'm going to give you back the rest of your day. I want to thank you for your time and thank you for sharing your expertise as always. Thanks for answering these questions. And then, once again, getting to know you and getting to, share in your experience as a business owner and a chiropractor.
Yeah, it's my pleasure, Del. Thank you.
All right. Have a good one.
You too.
All right, guys. Well, that's our show. I want to just once again thank Dr. Clay Sankey of TruMotion Therapy. Please make sure you go and follow him at TruMotion Therapy on Instagram. Of course, you can always check out his YouTube. And of course, if you are in the Charlotte area near the Arboretum store, we need to go ahead and have you click on that website, TruMotionTherapy.com, so you can see what's available in a schedule, read more about the anti-gravity treadmill, read more about all the services. There's some great blogs and content on there that I encourage you guys to check out as well. You guys have a great week. Don't forget, we've got our swim Splash Pass happening right now, 20 off of 75, and Garmin is on sale. You guys have a great weekend.